Hey you guys, welcome back to my channel. It's Kay. Now this week I have a viewer requested video that I'm gonna do because I think this topic is so important. Okay, so last week I talked about 4 EMS life-saving techniques everyone should know, and I got a comment from Anna Clayton. You know, it's like a little paragraph. Now I like when people leave me paragraph, but I'm not gonna read the whole thing because I want to get straight to the video. But she basically asked, you know, what is good to have in an emergency survival kit. So that's what I'm going to talk about today. If you want to find out what's in that kit, make sure that you stay tuned. Alright you guys, so a couple of days after I did the video last week, I saw that an employee at Chick-fil-A actually saved a kid from choking. He climbed out the window to save this kid, and it made me realize that these videos are very helpful, and this is definitely something everyone should know. So in today's video, I want to talk about general items you would see in your kit, and then maybe some unconventional items that you probably didn't think to have in there. Okay, and I don't want to break your bank because I know that people are on a budget and not everyone can afford some of these emergency kits that they have. I may find a good kit and put a link to it down below, like something from Amazon or something, but I want to give you guys just a few items that you just need to have in your kit, and maybe you can use items that you already have at home to put in your kit. Alright you guys, so we're going to start off with something that you probably never thought to put in your emergency kit, and it's definitely something that's necessary, especially if you have a family member that is suffering from addiction. So in your emergency kit, you're going to want to carry naloxone, and a very common brand of naloxone is called Narcan. So Narcan is what the firefighters, paramedics carry around, and now the police officers are actually carrying this around because they would get to the scene first, and there will be patients that die from overdose because they're waiting on the paramedics to get there. So now there are addicts and, you know, family member that are carrying this around. They have a nasal spray, and I'm gonna put a link below where you can get that. I'm not really sure of the laws and who can carry this or not, but I do know that they have it available. If you look at the news, you saw Demi Lovato. She overdosed on heroin, and her friend actually used naloxone to get her back. So it definitely comes in handy, and it's like, you don't want to enable people, but what you have to think about is that addiction is a disease. You know, it's really something that some people try to overcome, but sometimes it's really hard because that drug becomes a part of their brain chemistry. So it's really hard to kick that habit sometimes, but I say it's better to be safe than sorry. So if your family member has an addiction to pain pills, so that's, you know, Vicodin, morphine, hydrocodone, fentanyl, or even heroin, the street drug, you want to make sure that you have this handy. Okay, so this can definitely save their life, and, you know, usually to get off these drugs, you have to get onto another drug. You know, methadone is like a common drug that they use to get off of these opioids. Alright guys, so now on to your general items that you would have in your kit. Okay, so the first category is allergies, and generally with allergies you want to have your antihistamines, of course. So that's your Benadryl, your Claritin, Allegra, whatever you use for your allergies, you want to have that in there. But to take it a step further, you want to have an Epi-PEN in your kit. Especially if you have really bad allergies, it can actually close off your airway. So make sure that you have that Epi-PEN in a case of anaphylaxis. All right, so next in our kit, we're gonna talk about the category of diabetes and hypertension. And I group them together because usually if you have diabetes, you do have hypertension. So what you're gonna wanna make sure you have in your kit is a glucometer. So in a case of a diabetic emergency, your blood sugar can get really low, and that can lead to altered mental status. So you're gonna be like basically a drunk person. So if your family member is acting kind of weird, you want to make sure you check their sugar, if they're a diabetic. So if you see that it's low, you're gonna make sure that you have in your kit a diabetic snack. So generally that's graham crackers, peanut butter, and also orange juice. You can't really put orange juice in a kit, so you can use Gatorade, which is what they use on the ambulance. So you can have a couple of bottles of Gatorade just in case your sugar gets really low. Also, you're gonna wanna have something to do blood pressure with. Normally, we do blood pressures with a blood pressure cuff and a stethoscope, but if you don't know how to do blood pressures manually, you can get an automatic blood pressure machine and it will do it for you. So make sure you have that also, because if your blood pressure gets too high, that can lead to a stroke. Okay, so you want to make sure that you have that in your emergency kit. Alright you guys, so this next category you want to be over prepared for, especially if you have a history of like heart problems. Be over prepared, okay? So this category is chest pain and possible heart attack. Alright, so that's really scary. So you want to make sure that you have your baby aspirin in that kit. This is what we use on the ambulance, and also you need to have your nitroglycerin ready in case you're having really bad chest pain. Okay, so this is gonna help before EMS gets there. You want to take your baby aspirin or your nitro, and then you want to call 911 so that your blood can start thinning out to help in a case of a heart attack. Okay, you're also going to want to have an AED if you can afford it. All right, so most people cannot afford it, but if you can afford it, you may want to invest in an AED. Use your tax money, save up, whatever. Just have the AED in your home if you can, and also a pocket mask. Now, this is what you use to give those breaths during CPR, but don't worry about it if you don't have it. The main thing is chest compressions. Alright you guys, so our next category is hypothermia and drowning. So if you're dealing with any of these situations, let's say you live in the north and you know how they have those lakes that get frozen and then people skate on them. Maybe you have a situation where someone falls into that lake because the ice wasn't hard enough, so they fall into the lake, and then now they're suffering from hypothermia. So you got to make sure that you have an emergency blanket in this situation, because it's going to help them retain body heat. If you can't afford that, you want to just make sure you have a really thick blanket, and I know most of us have that anyway, so that's definitely something that you can put in your emergency kit. Alright guys, so our next category is burns, and usually with burns you have different degrees. So a first degree burn is usually when there's redness. Second degree, there's blisters forming, and you make sure that you don't pop those blisters, okay? Because if you pop them, that can introduce bacteria to the area. Okay, the blisters form for your protection, even though they look disgusting. So you don't want to pop those. And a 3rd degree burn is usually when the nerve ending is burnt off. I mean, that burn travels so deep that that person probably is not feeling any kind of pain. So that color is usually like a black or yellow color of the skin. All right, first, before I tell you what you need for a burn situation, I want to tell you what you should not use. Okay, so definitely don't use butter or any kind of oil. You know, I know that's like a common thing that people say, put butter on it, but butter actually makes it worse. And you know, butter and oil, they retain heat, and you definitely don't want that. Okay, so don't use any butter, and do not use ice. So those are things that you just definitely don't want to use in these situations. Also, do not use any kind of cotton dressings. What that does is it sticks to the burn, and that's going to be like really hard to get off. So you want to make sure that you stay away from that. Now, something that you could probably use at home is aloe vera. Okay, so that is usually really good on burns, and make sure that it's the pure aloe vera, because you know they sell it mixed with a whole bunch of other things. Use like the real aloe vera. So usually something that's very similar to aloe vera that you can buy online is called waterjel, and that's like a wet dressing. It's like a gel-like dressing that you can apply to burns. If you don't get the waterjel, you can also get a dry sterile dressing. Okay, so this is the dressing that you use for burns, not the cotton stuff. Okay, not the typical gauze or cotton dressing. You use a dry sterile dressing. So you're gonna want to get some sterile water to clean off the area. Just, you know, pour it over the area to cool it down, and then you want to apply the dry sterile dressing. All right, so our next category is bleeding, and this is a long list. Okay, so I'll try to make it simple, but yeah, this is the longest one. All right, so when it comes to bleeding, you always want to make sure that you're protecting yourself. You know, you want to have your safety precautions. So you want to have your gloves. Okay, so have a box of gloves or a handful, whatever. Just have some gloves in your emergency kit just in case you have to touch someone else's blood. Even if it's someone you know, use gloves, okay? Next, if you have like minor cuts, you know, you may want to have some ointment in there, some Neosporin. That's for cuts that are nothing too crazy. Also have some Aleve or any other pain medicine, like not the addictive ones, but you know, the Aleve, the Tylenol, stuff like that, just in case someone hurts themselves really bad or bleeding really bad. You're going to want to give them something for pain. So trauma gauze usually helps the blood clot a lot quicker when it comes to those wounds, you know, lacerations, maybe a gunshot wound, you know, stabbing. So if you can afford it, you can buy that online, or you can just have a couple of towels in your kit. Tourniquets are also something that's very important to have in your kit, and it's important to learn how to use these things, because if you use a tourniquet and you don't really know what you're doing, that person can bleed out. Okay, so when it comes to tourniquet, it's usually life or limb. Okay, so this is like our last resort when it comes to bleeding in the extremities. If the person just won't stop bleeding, usually you use a tourniquet. Okay, so I don't have a real one, but I do have like a scarf. You know, this is like a really long scarf. So if you want to use, you know, a scarf at your house that you have, you can use that, and you know, you can definitely use it to wrap around an injury. So in the case of an evisceration, and that's basically when your organs are on the outside of your abdomen. So if you are cut really badly, your organs can actually protrude outwards, okay? And that is a bad situation. Usually for this injury they use a wet dressing. So if you have like a sheet, like a flat sheet, you may want to wet that and put it over the injured area and your organs. And also you want to put an occlusive dressing over that wet dressing. So an occlusive dressing is something like Tegaderm or saran wrap. So if you have saran wrap, the little plastic wrap, you can put that over that wet dressing. Next, you also want to have sterile water. If you can afford the sterile water, then you can use like a regular room temperature bottle of water, but sterile water helps to flush the wound out. So if someone is bleeding really badly or they have a really bad wound, you want to clean that out so that germs don't get in that wound. Okay, so you don't use alcohol. Okay, so a lot of people think they're gonna put rubbing alcohol inside the wound, but you don't want to do that. At the hospital they use just sterile water. Alright you guys, so I know this is a long list, but stick with me, we're almost done, okay? Now this next category is smoke and fire, and I'm going to talk about two different masks that you're going to want to have in this situation. So in a normal day-to-day situation dealing with, just regular dust, or if you're like a germaphobe, or if people are coughing, they have the flu or something, you're going to want to wear one of these, which is just a surgical mask. And there's also an N95 mask. So an N95 mask offers a lot more protection than this basic surgical mask, and it's going to protect your lungs in the case of a fire. Okay, so you see on TV people start coughing really bad when there's a fire. This can help protect your lungs in that situation, and you want to make sure that you have a really good seal and get one that fits you. You can have just a box of these in your kit for your whole family. Last but not least on our list is a pen and a pad. Okay, so when you do any of these procedures at home, you want to make sure that you write down what you're doing and what time you did it, especially if you apply a tourniquet. Okay, so tourniquets usually have to be removed within a certain period of time, and it'll be really helpful for the doctors when you get to the hospital if you can tell them what time you applied the tourniquet. And also you can write down vitals, and it'll help EMS out, because when we go on scene, if you can tell us like what the blood sugar was or the blood pressure, that will be very helpful, because it will give us some kind of a baseline, so we can have something to compare it with. You guys, so that is it for this video. I hope that you create your emergency kit. Remember, it's better to be safe than sorry. And if you can't afford all these items, you can definitely find a lot of them around your house. I want to thank Anna for suggesting this video. You want to make sure that you hit that subscribe button, because your girl is on fire. I'm not slacking no more. So make sure that you hit the subscribe button, and if you have a video suggestion, make sure you put it below, because as you guys can see, I do listen to what you have to say, and I do make videos if I find that it will be very helpful. And yeah, that's it for me. I will see you guys next time. Bye.